The idea behind the conference was, number one, to, of course, improve the quality of care by bringing evidence-based recommendations and practices to the conference in the form of lecture or small groups. And the way we did that was we had a number of speakers here over the last 2 days, many of which who are local, but we also sought expertise from across the province, including Vancouver, Williams Lake, and around the Northern Health Authority. I think it's really important for people in the North to be also taught by people in or from the Centers of Excellence in Vancouver, because everybody here wants to uphold the same standard in the North, and our patients deserve that as well.
I think it's a pivotal moment for healthcare providers and auxiliary healthcare professionals to come together, to collaborate with one another, and to learn a bit more about how we can support my patients and our patients in Prince George. And by collaborating with various mental health professionals, including psychiatrists, social workers, psychologists, I am feeling more confident in where I send my referrals. I am feeling more confident in how I present treating my patients with mental health struggles.
So one of the highlights, I think, at this conference was that around the outside of the conference ballroom were exhibitor booths set up, and there were over 50 exhibitor booths, and those were all community mental health and substance use programs or Northern Health mental health and substance use programs. Northern Health was very generous in allowing their employees to attend this conference and be participants in the conference, but also at the exhibition booths. And it allowed participants at the conference and organizations to intermingle and network. And I think for me, for sure, as a provider, it made me feel like I'm not alone in this work, and that I have a lot of people that I can reach out to for help with these very complex and often challenging cases.
The importance of an event like this, I find in my work, is meeting folks who, like clinicians who are working. Like this morning, I chatted with a group from Dawson Creek who I can share care for folks that I'm seeing virtually in Prince George but live in Dawson or in Chetwynd or the other areas that team can serve, and then putting a face to a name and sharing contact and being able to provide better care for patients across the region by making connections with allied health.
You even have some social workers coming from Dawson Creek, which I think is a highlight for me to see how they manage their patients with multiple barriers to access health and to confront the challenges of the social determinants of health in their more remote settings.
Yeah, so I'd just like to thank everybody who came. The attendance that we had was unbelievable. The engagement of the people at the conference. Thank you for your energy and your attention over the whole last 2 days.